Do you often feel sick every time there's a little flu going around? Or maybe you've been on strong medicines and noticed you catch infections more easily. Well, your immune system might be getting a little too relaxed, not by choice, but because of certain drugs. This is called drug-induced immunosuppression. It happens when medicines like chemotherapy, used in cancer, or steroids, used for allergies, asthma, or inflammation, weaken your body's ability to fight germs. Think of your immune system like a security team guarding your body. These drugs, while helpful for treating serious conditions, sometimes tell the security team to take a break, and that can let viruses or bacteria sneak in. So even a small cold can feel like a big deal. Does that sound familiar? So what causes this immune slowdown? Mainly powerful medications. For example, if you're getting chemotherapy for cancer, those drugs don't just attack cancer cells, they can also hit healthy immune cells. Imagine you're cleaning a messy room with a powerful vacuum, but it also sucks up your favorite toys by accident. That's what chemo can do: clean up bad cells, but harm good ones too. Similarly, steroids like prednisone are amazing for calming down swelling or asthma, but if used too long or at high doses, they tell your immune system, take it easy, no need to react. This might help with inflammation, but it also means your body won't respond well to real threats like a bacterial infection. So the cause isn't a virus or bad genes, it's medicine meant to help, but with a side effect we need to watch for. Now, how do you know if your immune system is too suppressed? Let's play detective. Have you had colds that just won't go away? Or maybe a simple cut got infected more easily than before? Other signs might be constant tiredness, fever without obvious reason, or fungal infections, like thrush in the mouth. For instance, someone on long-term steroids might notice white patches in their mouth, or a chemo patient might get pneumonia from a weak germ that most people shrug off. These aren't normal. Your body is raising a little red flag. Hey, I need backup. If you're on these medications and notice infections coming back often, it might not just be bad luck. It could be drug-induced immunosuppression. How do doctors figure this out? First, they will ask, what medicines are you taking, how long? Then they might run blood tests to check your white blood cell count. These are your body's defenders. Low numbers, that's a clue. They may also look for signs of infection with X-rays or swabs. The treatment isn't about stopping your main medicine right away. Chemo or steroids might still be needed, but about managing risks. For example, your doctor might give you antibiotics to prevent infections, adjust your dose, or suggest vaccines, like flu shots, that are safe even when your immunity is low. The key is teamwork, you, your doctor, and careful monitoring to stay safe while treating your main condition. Can we stop this from happening? Yes, with smart choices. For example, never take steroids longer than your doctor says. No self-prescribing, even if you feel better and think, why not keep going? Also, basic hygiene is superpower level important. Wash hands, cook food well, avoid sick people. Imagine your body is low on soldiers. You've got to build strong walls. Staying up to date on safe vaccines, like pneumonia or flu shots, helps too. And regular checkups let doctors catch trouble early. It's like checking your car's oil. Small efforts prevent big breakdowns. Scientists are always looking for better ways to protect patients. New research is focusing on targeted therapies, drugs that fight cancer or inflammation without wiping out the whole immune system. For example, some new chemo drugs aim only at cancer cells, leaving immune cells unharmed. Others are studying immune-boosting supplements or drugs that can wake up the immune system safely during treatment. There's even work on personalized medicine, using your body's unique makeup to predict how you'll react to drugs. So in the future, treatments might help you heal without leaving you defenseless. Exciting, right?